It's time to take 5. Now you know.
We're visiting West Boca Medical Center, a Palm Beach Health Network hospital. Today we are speaking with orthopedic surgeon and chief of surgery, Dr. Ashish Sahai, about options for spine surgery and the importance of not delaying medical care. Doctor, you're an orthopedic surgeon who specializes in spine surgery. Tell us about the types of conditions you treat.
Spinal conditions can be found in a wide variety and range of age of patients, from the young to the older. And for that reason, what we look for is based on sort of what you've been through in life. Now, some of this can be younger population where they have scoliosis or disc herniations or things of that nature. And then some of the more middle-aged population deals more with pinched nerves, stenosis. And then we look for some of the older population that has other conditions that can be anything from scoliosis to spinal stenosis to cord compression to compression fractures. So we treat a wide variety of conditions.
Tell us about the procedures you use to treat patients who are suffering from back pain.
Back pain is one of the conditions that we treat, and it's necessary to sort of figure out what the reason for the back pain is. So before we can treat it, we provide the accurate diagnosis, and after that we have a wide variety of options that we can use to treat back pain. Now, we like to make sure that for isolated back pain, surgery is usually not just an isolated indication for that. So you can do things of cortisone shots, epidurals, physical therapy, and we try to manage that with conservative treatments. And then if that sometimes does not work, as it does in most people, then we opt for surgical management.
Many conditions, if left untreated, can become increasingly painful and even dangerous. What advice do you have for patients who may have pain or discomfort?
Anybody who has pain for more than a couple of days to a week, if you start to get worsening back pain or you get pain down your legs, it's a sign that you need to see someone. What we usually do is try to make sure that we have an accurate diagnosis, so we have to get imaging, x-rays, MRI, we do a thorough history and physical exam, and then we try to collaborate all those two to make sure that we rule out anything that's major versus something that can be very commonly found. So if you're really starting to develop those symptoms, and unfortunately during COVID, people sort of delayed their care, then we were faced with instances where they had severe spinal compression or cord compression and they required urgent surgery. And unfortunately, that was one of those things that became somewhat of a urgent to emergent type situation requiring spinal surgery.
There is a very robust orthopedics program at West Boca Medical Center. Why should a patient choose the hospital for spine surgery?
We helped develop the spine program. I specifically came here in 2008, and we have sort of developed it into an integrated program that offers some of the latest and greatest technology, including some of the machinery behind me. I've sought extensive training in spinal surgery and also in all the techniques. So I've traveled all over the country, learned from some of the best places, actually not only in the US, but abroad as well. And we do everything from small, less invasive type surgery to more complicated surgery done in a less invasive fashion to open and big complicated surgeries that require revision. So we've been able to determine and really develop a team here that's suited to treat these conditions, and they specialize specifically for these spinal conditions. And that, coupled with the hospital's multidisciplinary team of physical therapists and nurses and the OR staff, it leads to a collaborative effort to develop a rigorous program.
The hospital has a dedicated orthopedic nurse coordinator. She helps guide patients through the program to ensure patients' care is efficient, compassionate, and individualized. How does this benefit the patient?
Yeah, I think that, patients always want to recognize and see a familiar face. And in the hospital is an intimidating place. And so to have people that you recognize and people that you know and you've seen, and they demonstrate that care, that compassion, and that they can sympathize with you, and they understand what you're going through. And I think those are the people that you want to sort of lean toward. Then I think that makes your recovery and puts your mind at ease undergoing a very stressful time.
Thank you, Dr. Sahai, for all of this helpful information. We hope everyone understands it's important to take care of your health, and if you need surgery, please do not hesitate to go to the hospital. The doctors, nurses, and staff at West Boca Medical Center are there to keep you healthy and safe.